To discuss this is political analyst from Political Futures Consultancy, Daniel Silke. Thank you very much for your time this afternoon, Mr. Silke. Now, the timing of the coronavirus's arrival in South Africa is notable because the Health Department is already under pressure as it tries to convince skeptics that the national health insurance is viable here. How do you see these two issues intersecting?
But the issues do intersect, and I must just say the timing is also obviously unfortunate because of the technical recession that we are now in. So there are economic implications more broadly that will affect us. But national healthcare insurance, of course, has been a hot topic in South Africa in recent months. Government is trying to present a credible case that the state indeed can take on more responsibility when it comes to treating the majority of South Africa's citizens. And the arrival of the coronavirus clearly is going to test the readiness of state healthcare facilities, so the practical readiness, and also it's going to test the bureaucratic readiness as well. The Minister of Health thus far, and it's only been a few days, of course, since we've entered the global club of nations with a confirmed case, the Minister of Health thus far has put on a good show. He's looked credible, he's looked in control, and he's looked as though he's on top of the available information as well. Now, it'll be critically important for government to continue along this vein and to make sure that the potential spread is contained, and if it's not contained, to make sure that it's managed in an efficient way. Otherwise, it's going to be difficult to sell this enhanced role for the state in healthcare. So it really is an awkward time, but it offers the ministry and from the ANC point of view a chance to actually show that they can be quite efficient on this issue. And I dare say they want to take advantage of that chance that they have.
Now, looking at that readiness and the state of healthcare, specifically across poorer communities, the understanding is accepted that poorer communities will be hardest hit should the coronavirus spread amongst South Africans instead of just being imported cases. When we look at our healthcare system, it's already constrained, especially for those poorer communities. The Health Department has said it is ready. Do you believe that that readiness will continue to be the case should the virus spread further?
Well, I think at the very least, we've got a global focus on this issue. So, yes, I think the existing infrastructure has been weak. I think capacity at hospitals, particularly in more rural or poorer parts of the country, have been stretched or in many cases deficient, I might add. And we've seen examples of that. But where you've got a global focus, where you've got the World Health Organization offering distinct protocols and assistance, and the World Health Organization only yesterday did commend South Africa for being one of the countries that will clearly follow quite closely those protocols. I think at least on this particular issue, you've got a better chance of the state health facilities actually showing their mettle. Perhaps many of us have been somewhat unfair to critique and criticize absolutely everything about the state sector. And I think we shouldn't preempt the ability of the state sector to come to the party, so to speak, on this particular issue. But this is a real test. Make no mistake, it's a real test for the political authorities within South Africa, the Minister of Health in particular, and obviously our state sector on the ground. And it's a test that is not just a political test, it's a test that the people of South Africa also expect to be passed, because ultimately, of course, those who bear the brunt will not just be the middle classes who travel, but could very well be poorer South Africans who are affected by what's called community-based transfer of this disease.
Mr. Silke, while the world and while South Africa at large will definitely be focusing on the handling of coronavirus itself, surely there is a danger that the health sector's handling of everyday medical issues will fall between the cracks, as it were, and that while there is an influx of people not only looking to be tested, dealing with symptoms they might be posing, trying to deal with actual cases of the coronavirus, regular patients and people with other legitimate health queries might not be as efficiently dealt with in an attempt to make sure that we are seen to be dealing well with the coronavirus.
Yeah, you're quite right. And I think this particular issue is not just a South African issue. We've seen that discussion in the UK at the moment, where the National Health in the UK are going to be severely constrained given the limited amount of beds that are available per head of population. Now, in South Africa, we know that the state sector has been severely stretched. We know that many hospitals are almost verging on the dysfunctional for existing cases. So one clearly doesn't just want a position where the coronavirus is dealt with relatively efficiently, but other cases are, in a sense, shunted or relegated to a secondary position. And managing, of course, both sides of that equation, the new virus and existing cases, is yet again a critical test for our health authorities. Look, no one wishes this upon anybody, but it is a chance for our state health sector to really jack up the act. And I think we are up to the task of it. I think we are capable. And I actually like the notion from the Minister of Health that, we should see this in the broader context, and that we should look perhaps more cogently and practically at the position within South Africa rather than be hysterical about it. But the test is with us right now. We've only had one confirmed case. One would expect there to be more cases for sure in South Africa. But there is an advantage, I suppose, to us here in that we are more isolated from Western Europe and from China. The African cases themselves that we've seen, whilst spread across the continent, are very often more prevalent in North Africa, where there's greater connectivity, particularly to Europe and in particular to Italy as well. And let us hope that we at least do not bear the brunt of a large number of cases in South Africa where we have to confront these issues. But managing it, isolating those who are potentially who can transmit the disease, that's going to be the key issue here. And investigating each and every disease and having the capability to investigate the chain of who potentially could be infected, that's going to stretch our authorities to somewhat. And I do think that we've got the ability to counter this. Politically, the pressure is on. And strange things about South Africa, when the pressure is on politically, somehow we do react, and we do react positively. So I hope that's the case here.
Right, thank you very much. Positivity and insights coming there from Daniel Silke from Political Futures Consultancy. Right, coming up, we move on to some other news.